and welcome everybody to today's webinar. Just a little bit about me before we get started, so that you can understand where my knowledge bank comes from. I have worked with the Witherslack group now for 10 years plus, advising and supporting parents in a lot of areas, but particularly education, health and care plans. So I've done my professional training with EHCP, who a lot of you may have already heard of, which takes me up to level 3, which includes tribunals and appeals. Hopefully today we are going to look at a very simplified way of understanding education and healthcare plans, and a little bit of myth busting as well. So hopefully this is going to help any of you that are on that journey. So let's get started. So first and foremost, what is an education, health and care plan? It's a legal document that sets out the young person's needs. So you'll hear that called SEN, special educational needs, and the provision that's required to meet those needs. So that's SEP, which is special educational provision. It must cover education, but it may also cover health and or social care needs as well. And it's governed by certain legislation, which is the Children's and Families Act 2014. And that's the law, basically, that covers education and healthcare plans. And then alongside that is the Special Educational Needs and Disability Codes of Practice, which is the statutory guidance that outlines the duties and responsibilities for local authorities, schools and professionals working with children. Okay, so who can make a request for an education, health and care plan? So the child or young person's parent carer, the young person themselves, if they are over 16 but under 25, or the school or post-16 provision that the young person attends. So when we talk about a young person who's over 16 but under 25, that's your statutory school age. And if a young person is over 16, obviously they then would be able to make the application. If they don't feel confident or haven't got the capabilities of doing that themselves, parent or carer can do that on their behalf. Okay, so when should an ECNA, as it's often called, or an education, health, care needs assessment be carried out? There's only 2 tests that the local authority has to satisfy when deciding whether or not they are going to do an assessment for an EHCP. It's a really low threshold, and these 2 areas are often, when we talk about myths, they're often misunderstood. So to make it very clear, if a child has or may have special educational needs, and they may need a special educational provision to be made through an EHCP, the local authority must carry out an EHC needs assessment. Okay, we use words like must, should and could throughout this, and when we talk about the Children's and Families Act and statutory guidance, if the word must is in there, then that is generally a legal duty that the local authority must carry out. Okay, so what are some common myths? We often hear when we talk to parents within the Witherslack group, and we're supporting those parents, that they've been told that their child doesn't meet the criteria. Well, we've just talked about what the criteria is, and it's a very, very low threshold. Your child has or may have special educational needs, and they may need an EHCP. Parents are being told that they must have had 3 rounds of SEN support in school first, or that they need to have had the notional budget of £6,000 spent on the child before they can assess for an EHCP. These are all myths. Often they hear that, well, there isn't any funding to get the assessments or reports, or that we only do so many a year and we've actually hit that threshold. And these are all unlawful reasons for not carrying out a needs assessment. They have to have 3 areas of need to be assessed. Well, they don't. Schools have to make the request. We often hear that as well, and schools will say, well, we don't think they need one, or they're not going to get one. Needing to have a diagnosis. You do not need to have a diagnosis in order to apply for an EHCP. The child needs to have special educational needs. Another one that we hear quite often is that they're achieving academically, so they don't need one. Well, special education covers lots of different areas, not just academics, and we'll talk about that a little bit further on. And another one is that there's no issues in school, so they don't need one. They're doing fine. But we often hear about masking, so young people that will be in school, they'll appear to be coping really well in school, and then going home and exploding like the old Coke bottle that's been shook up all day, because they're masking and they're not able to cope. And that might be the environment that's not right for them. Lots of other things, sensory, it could be one of many things. Okay, so what are the definitions of SEN or special educational needs? So the first one is, do they have a learning difficulty or disability? So a child of compulsory school age or a young person has a learning difficulty or disability if they have significantly greater difficulty in learning than the majority of others of the same age, so their peers within their class group or their school setting. Or they have a disability which makes it difficult for them to use the facilities that are normally provided for the others in the same age. And that would be in a mainstream or post-16 provision. And the second point is, does that learning difficulty or disability call for special educational provision to be made? And if it does, then they do class as having special educational needs. So the above that we just talked about relates to children of compulsory school age. So what happens if you have a younger child? If a younger child or preschool age is treated as having a learning disability or difficulty, if it's likely that when they start school, that they will have those difficulties that we've just talked about when they reach compulsory school age. Or it would be likely that if no special educational provision were made for them, that they would struggle. Okay, so let's look at some examples of special educational needs. So we talked before about the academic side of things, but there's lots of other areas of SEN. And it can be medical conditions, but it's challenges and barriers to their learning. So reading and writing, things like dyslexia, dysgraphia, dyscalculia, all those sorts of things potentially would present with a special educational need. Their ability to understand things, and that could be for a whole range of reasons. It could be that they've got a learning disability. It could be that they've got a diagnosis of autism, which makes it more difficult for them to process information. Lots of different things could come under that one there. Behaviour or the ability to socialise, so struggling to make friends, being very isolated within school, or what we often call challenging behaviours. That these are all things that could potentially come under the SEN umbrella. Concentration levels, so things like ADHD, and physical abilities to do things such as writing. On top of that as well, you've got things like sensory needs, speech, language and communication, and the list is not exhaustive, but it was just to give some ideas of why we say that they don't have to just be academically behind in order to be considered for an education healthcare plan. Okay, so some tips when you're applying for a needs assessment. Submit as much evidence as that you've got. So it's really helpful if school are on board with you and are happy to provide that evidence for you. But quite often parents have that barrier where school are saying, well, they're doing okay, so we've got nothing, we've got no evidence. Attendance would be evidence. So if their attendance is low, struggling to get into school, the behaviours when they get to school. Establishing a point of contact with the local authority. So build a relationship if you can that's positive with the team in the SEND team at your local authority, and try and communicate with one person if possible. And I know that's difficult because we all know that people go on holiday, people move around in teams, but just try and establish those close links with the LA. Keep a diary and a written diary of anything, any communication that you've got with the LA or school. So if if you're submitting something or a request, just make sure that you keep a record of that. If you're sending emails, have a separate folder where you can drop those into, so it's all together and you can go back to that at a later date. Don't send originals of official documents. Send only copies. Keep the originals with you because obviously they're yours and you may need them at a later date. And make sure you keep copies of everything that you send off. Okay, so what are the timescales for an EHCP? The clock starts ticking on day one when the local authority receives your request for a needs assessment. That is day or week one. And in the event that they agree to issue an education, health and care plan, they have 20 weeks from that date in which to finalise and issue that plan to you, okay? So in weeks 0 to 6, so week zero is when that clock started ticking, when they receive the application, they need to give you a decision as to whether they are going to carry out the assessment or not. So that should be with you by week 6. Between weeks 6 and 12, if they have agreed that they're going to carry out an assessment, they need to get all the relevant reports together and actually do the assessment to decide whether or not they're going to issue a plan. Somewhere between weeks 12 and 16, the plan, if they have agreed to issue, needs to be drafted and a copy sent out to parents and carers. And then by week 20, the plan should be finalised. Okay, so that's a quick overview of the timescales that we're looking at. Okay, the athletics track. So this is a good way of explaining what hurdles you might come across and whether or not those hurdles are going to stay up or whether you can knock them down and move on. So if you imagine that you're on an athletics track and you have got 4 hurdles on there before you get to the finishing line. You're in the middle of the track, you've got your tracksuit on and you're warming up. That's where you've got SEND support in school. So your child is under the SEN support and you're aware that things maybe aren't going too well. So get the tracksuit off and let's get on the starting blocks, okay? So that's where you make your assessment request. The first hurdle that you potentially might come across is that the local authority don't agree to carry out a needs assessment, okay? At that point, you can appeal. So if you're told they're not carrying out an assessment, you have a right to appeal at that stage. Hurdle 2 is the agreement to issue a draft EHCP. So we talk about that 12 to 16 week window where they should be issuing the plan. If you get a decision that says they're not going to issue a plan after the assessment, you have a right to appeal that as well. The third hurdle is the agreement around the contents of the plan. So if you imagine that you've been issued with a draft plan and you've gone through the relevant sections of an EHCP, which we will talk about a little bit more in a moment, and you're not entirely happy that those the contents of the plan are relevant or they don't represent your child effectively or things have been missed out, you can appeal that as well. So hurdle 4 is the agreement about the school that's going to be named in the plan. And again, we'll talk about that a little bit further down. You will then get to the finishing line. Hopefully a final EHCP will be issued at week 20. If you're not happy about the final plan, you can appeal to the SEND tribunal. So at the draft stage, when you're looking at the contents, you would only be having conversations with the local authority at that stage about making amendments to it before it's finalised. Once it's finalised at week 20, if you're not happy with the content or the school that's named in section I, you have a right to appeal. Okay, so what happens during the assessment? We've rolled on there right to the end of the plan, but let's go back to the needs assessment. What happens? So during assessment, local authority must, and this is that legal must again, seek advice from the following people. The first one is the child's parent or carer and the young person themselves. The head teacher or principal of the current school or provision, educational psychologist, healthcare professionals, social care, any other person that the local authority thinks is appropriate, and any person that the young person or parent reasonably requests. Okay, so your draft EHCP. Hopefully that this draft has arrived within that sort of 12 to 16 week window and you've got it in front of you and you're looking at it thinking, what now? What do I do with this? Okay, so the first thing to remember is that in a draft EHCP, the school must not be named. That needs to be left blank until you get your final plan. And the reason for that is that A school can only be decided, the most appropriate school can only be decided once you know what the needs of that child are and how they need to be supported. So if you're still having conversations with the LA about making amendments to Section B and Section F of the plan, then the school should not be in there until that's all been ironed out and we're all happy with the needs of the child and the provision that needs to be in place. Okay. When you receive your draft EHCP, it must be accompanied by a letter that outlines certain points. So it must tell you that you have 15 days in which to make representations to the local authority. And what that means is that you've got 15 days in which to go back to them and challenge anything that you feel needs amending in that plan. And there's certain sections that you really need to look at, okay? And we'll chat about that again in a few moments. So 15 days to make representations. And let me rewind. 15 days to make representations. It must also be accompanied by all of the appendices. So all of the reports and advices that were sought during the assessment need to be attached for you to be able to read through and make sure that everything that's in those reports is then reflected in the EHCP. Okay, so if amendments are agreed, or if you don't feel there's any amendments need making, then the final plan will be issued at week 20. Okay, so what are the contents of an education, health and care plan? So education, health and care plans in different local authorities take different formats. Some have pictures of the young person, some are sort of clumped some of the sections together. So maybe the section B and section F will be clumped together and you'll have 2 columns. But what a plan must have is the following sections. And this is legally, this is what an EHCP should contain. So it needs to have section A, which is the views, interests and aspirations of the child and young person. Section B is a description of the child or young person's special educational needs. Section C is any healthcare needs. Section D, social care needs. Section E, any outcomes that are sought. Section F, the provision that's required to meet that child's special educational needs. Section G is healthcare provision. Section H1 is social care provision that's required under the Chronically Sick and Disabled Persons Act. And Section H2 is any other social care provision. Section I would be the school. And again, remember that that will only be named in the final plan, not the draft. Section J would be any personal budget that's been applied for and allocated. And Section K is all of the advices and reports that were gathered during the assessment. Okay, so before we talk about naming a school, I think I just want to give you an additional top tip that I found really useful, and a lot of parents that I've spoken to have gone on to use it. When you get all of the reports that come with the appendices in Section K, get yourself 2 highlighting pens, 2 different colours. So let's say we've gone with a pink and a blue. The blue one you will use to go through all of those reports and highlight anything that is your child or young person's special educational need. So any needs that they've got. So it may be a sensory need, it may be a diagnosis, it may be that they can't sit still, they've got ADHD, they're up and wander around the class. All of their special educational needs, highlight them in blue. With your other colour, your pink pen or whichever other colour you've chosen, go through and highlight every provision that's been recommended in those reports that needs to be put in place to meet those needs. So it may say that your child or young person has a diagnosis of ADHD, struggles with concentration, cannot sit still in the classroom, and the provision that's required may be that they need a wobble cushion, or they need a particular type of equipment, or they need regular movement breaks. So that's going to go into Section F. So you've got your 2 colours, Section B, everything that's in blue in your report, you need to make sure that it's represented in there. And with your pink highlighting pen, you're going to make sure that everything that's in the reports in pink is in Section F. So for every need that's in Section B, there should be a provision in Section F to say what is going to happen in order to meet that need. Okay. So let's move on to naming a school. So when you receive your draft EHCP, along with a letter saying that you have 15 days to make representations, your local authority should also be asking you to tell them which school you would like named in the plan. Okay. There are only 3 reasons that a local authority can refuse your choice of schools. 3 legal reasons. Okay, so the first one is that the school is unsuitable for the child's age, ability, aptitude, or special educational need. So that might be there is the school, let's say, that's specifically for children who have, it's an autism specific school, let's say, and your child doesn't have a diagnosis of autism, they've got social, emotional, mental health needs, then potentially that school isn't going to be the right school for your child. Again, if it's different ages to your child, then obviously they can refuse to name that school. The second one is that placing your child in that school would be incompatible with the efficient education of other children or young people. This is quite often used when a school is full, because legally they can't refuse to admit a child or young person just on the grounds that they're full. They would have to evidence that admitting your child would be inefficient or incompatible with the efficient education of the other children. So just remember that they can't come back and just say, well, we're full. They would need to evidence why that's going to have a detrimental impact on the other children. And the third reason is that admitting your child to that school would be incompatible with the efficient use of resources. So this will come down to the cost of the placement. If your choice of school is significantly different, more expensive than the school that the local authority are planning to name, then they can use this as a reason for saying no, okay? So what type of schools can you request the local authority to consult with in an education, health and care plan? You have the right to request any of the following types of provision. Maintained schools or nurseries, so mainstream or special. Academies, mainstream or special. An institution of further education sector, so a college. A non-maintained special school. So these tend to be charity more than anything else, where they're not-for-profit organisations. And a Section 41 school. So they are usually independent schools, but they are registered as a Section 41 school. Some independent schools are not, and you do not have, you can request a non-Section 41 school be named in your child's plan, but the local authority haven't got the same duty to consult with them, so it then makes it very difficult for you to evidence that that school might be appropriate for your child. Okay. So if it's not, the school that you want is not on the Section 41 list, you can try and remind the local authority that under Section 19A of the Children and Families Act 2014 and Section 9 of the Education Act 1996, local authorities must consider any other request that the parent makes. So if you're requesting a school type that's not on that list that we've just looked at, they must consider it, but by considering it, that doesn't necessarily mean that they're going to consult with it, because they could just say, look, we're aware of the fees for that school, or we're aware that it's not suitable for your child, so we have considered it, but no, we're not going to consult. Okay, what are your rights of appeal? So when you get your education, health and care plan, if you're not happy with the contents of sections B, which is your SEN, your special educational needs, section F, which is the provision that's required, and section I, which is the school, you can appeal those at the first tier tribunal. If, as I've said, you won't be able to do that at the draft stage, you have to wait for the final to come through. So you might have several drafts going backwards and forwards where they're making amendments to it, but you cannot lodge that appeal until you've received the final version of the plan. Okay, sections C, D, G and H of the plan, you can make an appeal around those sections, but it has to be in conjunction with the contents of the plan, so sections B and F. You cannot just put an appeal in for section C, D, G or H if you're not appealing any of the other 3 sections, which is, sorry, sections B and F. But as I've said, it doesn't carry the same sort of weight in an appeal or a tribunal either. And a tribunal can only make recommendations on sections C, D, G or H. They cannot enforce it if the local authority choose to ignore it. What they would expect is that a local authority does pay attention to any recommendations that the tribunal orders. Okay, what needs to happen after you have received your final plan? They've started in a new school or staying at the school that they're at with additional support via the plan. What happens then? Because this plan potentially could run until your child or young person is 25 years of age. So in order to keep it relevant and current and be reflective of your child or young person's needs, it must be reviewed annually. So a year from the date when that plan was finalised, there must be an annual review. Now, there are times when you may have an earlier review of the plan, and that would be if there are significant changes that have happened since the plan was issued, or if things are changing significantly at the school and you don't feel that their needs are being met anymore. You can call for an emergency review. Sometimes it's called an emergency review, sometimes it's an early review, and sometimes it's an interim review. And that would be just treat the same way as if it was an annual review, but it would be sooner. It keeps all the documents up to date and relevant, make sure that we're still, appropriate for your child's needs. The local authority are responsible for carrying out the review, but it's generally held, if your child is attending a school, it's generally held in the school, and they will do all the invites and send them out, but the local authority is responsible for making sure that it happens. And as I've said, the school will usually arrange and host the meeting. Okay, what are the 3 outcomes potentially of an annual review? So you've had your plan for a year, you've had your annual review. What potentially could happen at that stage? Well, the first thing that could happen is that the local authority maintain the plan exactly the same as it is. The child's not met their outcomes yet, so they're going to continue with what they're doing. They're making progress, but nothing needs to be amended. So it would be to maintain it with no amendments. The second option is to maintain the plan, but to make amendments to it. So your child has, some of the outcomes, they've achieved them, we want to change it, we want to add some in, or we want to move things around and just, make some changes to that, or that they need additional provision put into section F, or that their special educational needs have changed. So the plan may be amended at following the annual review. And the third option, open to a local authority following a review, is that they cease to maintain the plan. And that would be that they've said all outcomes have been met, they no longer have special educational needs that need to be supported with the plan, and we're going to cease to maintain it. It's quite rare that that happens, but it does, and it can do, so it's something to be aware of. As with a new EHCP, you do have rights to appeal following an annual review, and I've not got the time to go into all of that too much, but basically if the local authority make any of those 3 decisions and you don't agree with it, you do have rights to appeal, and the finalised amended plan should come to you with a letter that outlines your rights to appeal that decision again through the First Tier Send Tribunal. Okay. There are some points in your child's life where particular types of reviews need to be held, and these are called transitions or phase transfers. And these need to happen when a child or young person moves into a different phase of education. So we talk about them moving from early years, nursery type provisions into reception at school, juniors into secondary, if we're talking old school, or a secondary to a post-16 placement. And there's very strict legal guidelines, strict legal dates that need to be adhered to. So for any child that's moving from nursery to primary and primary to secondary school placements, that phase transfer needs to have happened, and you received your final plan naming the new school for September by the 15th of February in the year that they are moving into their new phase of education. For any post-16 placements or moving from secondary to post-16, that date is the 31st of March. Okay. Okay, so that kind of sums up the process for EHCPs, but we have a variety of resources that you can tap into that will explain things in a lot more detail than we've had the time to do today. So the first one would be our website, which is the Witherslack Group website. We have free resources on there, which includes this podcast about the EHCP that explains it in a little bit more detail. Annual reviews, phase transitions, appeals, it's all in there, and it's all free of charge. You just need to log on to there and just go to the relevant sections. We have an EHCP support pack within our resources, but we've all sorts of other support packs in there as well. Your local SENDIAS is a good source of support. So that's your special educational needs, disability, independent advisory service, and you'll find them on your local authority's website. So if you type in, say for example, Lancashire SENDIAS, it should take you straight to their website. And also your local authority's local offer. So a SEND local offer is it's a directory of services which should list all of the support services that are available in your area, but also lists of schools. So if you're not sure about which school that you're you're looking for your child, it should all be on the local offer. And that's it from me. So I think this is going to open up now with Molly for any questions that we might have.
Yeah, that was brilliant. Thank you so much, Simone. We've had, I think I've counted about 60 questions, so we'll try and get through as many as we can. If you just want to stop sharing your screen so we can see.
Sorry.
Is that all right? There, perfect. Okay, so the first one is, if the school nurse is recommending an EHCP, but the school say he doesn't need one, can I still apply?
Yeah, absolutely. I think we covered that, didn't we, in the early slides? You do not need the school to apply for an EHCP needs assessment. It's absolutely, parents have got every power to do that themselves. It just can be a little bit daunting, not knowing what to expect, but the forms that you get from the local authority should list exactly what you need to be putting in there. And it's evidence-based. It's getting as much evidence together as you can to show where your child is struggling and how the support in school is not enabling them to progress. But yeah, absolutely they can.
Yeah, brilliant. Thank you. The next question is, what do you do when the local authority do not follow the must in the SEND code of practice?
Oh, that's a big one because it depends what must we're talking about. I mean, if we're talking about time, let's use an example for you've applied for an EHCP, you've not had the decisions within those legal timescales, or they've not issued the plan. There's a couple of sort of courses of redress that you can go down. I would always say that, it's massively important to try and maintain that positive relationship with the LA first and see if you can resolve things with them. Quite often that doesn't happen. So the first thing that you would need to do, or you can do, is to lodge a complaint to the local authority through their complaints policy or process. Now, there should be a copy of that on the website. Every local authority should have a copy of their complaints process. You put it in writing to the local authority. If you are still not satisfied within, I think it's 12 weeks of your complaint, you can go to what's called the Local Government Social Care Ombudsman, which is the LGSCO. You have a look on the internet for that as well. They deal with any complaints that are about the local authority. So we're not talking anything that's necessarily unlawful, but they can investigate it for you and try and resolve it. And they can put certain things in place and put pressure on the LA to get things sorted. The third one is what we call judicial review. Now, judicial review is where there has been an error in law or a breach in law, which, if it's a must, and we're talking these timescales, then technically it is unlawful, and you could go down the judicial review route. But you do need a solicitor to engage the judicial review. What often happens is that a solicitor will be able to do a letter for you, which is what they call a pre-action protocol letter, and often that's enough just to make the local authority sort of sit up and go, okay, we need to resolve this and get things sorted out. Look into legal aid if you need to go down the judicial review route as well. Quite often it goes on the young person and not the parent's income. So because they're representing the child, but it's really important that you check with any barrister or any solicitor that you're going to engage what those costings could be, because potentially if you lose, then there could be some sort of significant cost implications as well.
Right, yeah. And did you say the name of that website was LGSCO?
Yeah, which is the Local Government Social Care Ombudsman. It's a slightly slower process because you've got to wait 12 weeks until the LA have been given chance to address your complaint. If they don't, you then get in touch with the LGSCO and they then have to investigate it. So if you've got an urgent case and it's having a significant impact on your child and you need things doing quickly, you potentially should go straight to the judicial review route. But as I've said, that's a completely different route, and just be aware of what the pitfalls there are as well.
Okay, brilliant, thank you. The next question is, can a parent or carer share the EHCP with a sports club to help them understand their needs, or is it only for school education use?
It's for special educational provision, so it really is for use within the establishment that your child's attending. But there's nothing wrong with your permission. You know, if you, as a parent care, if you feel there are things in there that would help other people to understand your child, then absolutely, you know, share that information. It needs to be a holistic approach, which is why we have health and social care in there. Everybody should be working together with one aim, and that is to make sure that all that provision that's in that plan is delivered to that young person so that they can make progress alongside the peers. So yeah, absolutely.
Brilliant, thank you. We've had quite a lot of questions about summer holidays. I guess it's good timing, really. So this one is, all the common myths are exactly what my son's school, what the school has given me. However, my son hasn't had an educational psychologist yet, only a school counsellor. He has a recent diagnosis of autism and ADHD. The school have also said their budget is already spent for an autism teacher, but they buy in a period and this helps for EHCP. They said they look at it in autumn. Do you think it's worth, or can they still apply for the plan themselves over the summer holidays?
Absolutely, yeah. So applying for an EHCP, that 20-week window is a 20-week window. It doesn't matter. There are only very few reasons why a local authority can delay issuing a plan. Now, there are going to be difficulties, obviously, if you apply over the holidays. And that is because the SENCO is potentially not going to be working at the school and not able to provide the information that's required from the school. But in terms of educational psychologists, then the summer holidays it doesn't matter. They work throughout the year, and the local authorities still have to onboard an educational psychologist. Apply as soon as you can, because even if there are delays, it's going to be quicker than waiting for September when there's potentially going to be another influx of applications, which could further delay things.
Yeah, brilliant. Thank you. The next question is quite a long one, but so this is, thank you so much for this input. I have long asked for an EHCP. I've always been told he's not eligible because he's coping academically. Since being in secondary, he's really not coped. He's now 15, GCSE years, really struggling. He wasn't able to do any mock exams, hasn't done a full day in school all of year 10. He also acts as his specialist despite having a needs assessment, and he has caring responsibilities for me as the parent and a very complicated home in terms of social care. He's seen every professional you can think of. His MSP has not been maintained properly and isn't worth the paper it's written on. School still won't let me help. School won't help me apply for an EHCP, even though I do have a good relationship with them. Please help. What can I do? Applying for myself is more than I can cope with because of my own needs.
Yeah, okay, and that's quite common. You know, there's a lot of parents that are really overwhelmed with. I'm a parent myself to a neurodivergent. He's an adult now, but I've been battle weary myself, and I know how it feels to think I haven't got this fight left in me. Okay, there are a lot of support services out there. There are advocates. Some of them pay, you know, some of them cost quite a lot of money. Some of them don't. There are some charities as well that can offer support and help, and actually reaching out on social media forums. So, I've been on the Facebook forum. Some of the advice isn't great, so be really careful about what advice you're taking from people. But there's parents that have been through it, and they're more than happy to jump on board and help. You absolutely need to, overrule the school. Well, it's not overruling it. You're taking your rights and you are applying for a plan for your child. but reach out for support. You know, we've got an advice and support line. If you send a message via our website on a contact us form, we might be able to give you some advice over the phone in terms of who to reach out to and where you can go for that support.
Yeah, brilliant. And someone else, a different parents asked a question sort of related to this. So, struggling to get school on board as my child hits academic criteria. However, it is more social and emotionally. So, what evidence is best to gather for the application for social and emotional?
Oh, anything, attendance, behaviours, exclusions, lack of friendships, inappropriate friendships, you know, being vulnerable, being easily led, behaviours at home. So this burning out at school, coming home and lashing out when they get home. There's anything that is not, that you think is not right, is evidence. So social and emotional can cover a whole host of different things. It could be that they're really withdrawn. Children withdraw when they're not coping socially and emotionally. That masking, that you know, self-harm. It's such a huge area. Anything that covers behaviours, the ability to cope, struggling with friendships, that's all evidence.
Yeah, brilliant. Thank you. Next question is, what happens if from initial assessment 4 years ago, the child's needs have now changed? How can you get an up-to-date assessment?
There's some recent legislation, well, not legislation, changes, certainly on the tribunal side of things, where they're saying that they won't accept reports that are more than, I think it's 3 years old. Could be wrong, I could be 3 to 4, but anything over 4 years old. And again, it depends on, I was talking to a parent the other day who'd had an ed psych report done for their child when they were 3 years old. They're now 8, and how can an 8-year-old be the same as a 3-year-old? They can't. So I think anything over 2 to 3 years, if you are concerned that it doesn't reflect your child as they are now, as they present, then it's not unreasonable to ask for a reassessment.
Okay, brilliant. Thank you. I've had quite a lot of questions on school avoidance or emotionally-based school avoidance. This one is, my child in year 5 has emotionally based school avoidance, and school are saying they need her in on time and every day to gather enough evidence to do the EHCP.
That is evidence. That's enough evidence. Yeah, a child not being able to attend school is evidence. Your evidence is there. Attendance. Yeah.
Yeah. And the next question is, hello, thank you so much for this presentation. It's given me so much to think about. My 10-year-old it's another emotion-based school avoidance. 10-year-old struggles emotion-based school avoidance. He has anxiety, has been diagnosed with ARFID. He has no issues with learning, and for this reason, I have been told by numerous people in different professions that he wouldn't be able to apply for an EHCP. His school attendance has dropped significantly over the past 4 months. Can I apply on these grounds?
Absolutely. Yeah, all of the above. Absolutely.
By specialist education provision, does this have to mean a special school, or can it be extra help in mainstream school?
Yeah, absolutely. That's a really good question, actually. That's probably something I should have included in the presentation. No, so what your SEP, your special educational provision, is what provision needs to be put in place in order to meet the needs, the special educational needs. It's a bit of a myth that every child with an EHCP will be in a special school. The majority of children that have an EHCP have their needs met in school. The whole point of the EHCP is to get them the additional support in mainstream. Now, there are obviously then children who, you know, despite having an EHCP, mainstream is never going to be the right provision for them, and those children will need to attend a special school. But yeah, you know, every child has a right to be educated in a mainstream environment if that's right for them.